Welcome to the cutest puppy video on the internet. This is puppy Pierogi, and soon you'll see puppy Pork Crackle. Both puppies are rescue puppies, and both came into rescue as little puppy neonates. Follow along and see how they grow in front of your eyes and the kind of care that we in rescue give these puppies. Patty, are you waiting for me to feed the baby at my little makeshift tube feeding station? Are you waiting? Are you camping out? Just waiting for the milk to heat, Baba. And then I'll bring your baby out, okay? Bring your little baby out soon. This big boy here that you see faux nursing puppy Pierogi, his name is Patty Cakes, and Patty Cakes is a 9.5-year-old rescue mutt. We like to call him a pit bull, but we actually really don't know what his mix of breeds are. At the time of this video, Patty was very sick with lymphoma cancer. Sadly, a couple of weeks after this video was shot, Patty did pass away, but he really loved nursing puppies, as you can see. This nursing habit that Patty always seemed to have when it came to young puppies really started back when Patty was a puppy himself, when he was about 6 months old. We had a box of ducklings, 2 little ducklings, dumped on our doorstep one day many years ago, and Patty just really took to them like a duck to water, and ever since then he's always loved nursing puppies. So it was really nice that he had Pierogi in his last few weeks of life, because it was what he loved and what he did best. And as you can see, Pierogi really loved nursing on Patty. Oh, and I should mention, Patty Cakes is a boy, just like Pierogi, so he doesn't have any milk, of course. Now, I should mention that I didn't really think to take any videos of puppy Pierogi in the earlier days, so we're going to move on to Pork Crackle now. This is not a tube feeding tutorial video. Rather, I am just going to document the first tube feed of our new little neonatal puppy, who is an almost 2-week-old bilateral cleft lip English Staffy. He's a little boy. His name is Pork Crackle, and he's come from Sydney. Pork Crackle is almost 2 weeks old. I've got to get his exact birth date from the breeder, but essentially he was fed human milk replacer, so human baby formula, and yeah, it's not the best. I'm just going to read this here. Yeah, so he was taken into rescue care by a volunteer who was volunteering for us. Her name was Stacey. Stacey was in Sydney, or is in Sydney, and she takes care of wildlife. So she is pretty good with tiny little babies. So she was bottle feeding with this bottle, which is like a kangaroo pinky teat. I think it's it's not a pinky teat, it's a joey teat, I think this one is. It might be a possum, I'm not sure. And she moved him onto the correct formula. I think the breeder did, after I spoke with her and told her to go get some new one. I don't use a powdered formula. I make up my own formula from a recipe that's called Leerberg, and if you Google that, it's pretty well known around the world. A lot of breeders use that, and basically you make it fresh. I make it with goat's milk, goat's yogurt, egg yolk, and glucose, and I heat it up in a bottle warmer, baby bottle warmer, so it's nice and warm. And basically I'm going to start tube feeding this little boy for the first time, because he's not 100%. So what I'm going to do, it's sort of, I've already had a little feel of him. I haven't weighed him yet, and really you should weigh, everyone should be weighing a new puppy. But I've been doing this for so long, I'm pretty confident I know exactly how much to feed him. So I'm going to feed him 6 mils to start with, because he's really tiny for a tiny 2-week-old. Actually, I might feed him 8 mils. So what I'm doing at the moment is I'm just putting in the Leerberg into the syringe, and then actually what I'm going to do is pull the syringe down. I have this little trick. This is how I make sure that all of this antibiotics, which is what we've got him on because of how he was being fed, he has an infection, and he might have aspiration pneumonia already, although Stacey did take him to her vet, and her vet said the lungs were clear. But sometimes aspiration pneumonia can take a few days to rear its ugly head. So a puppy can sound really clear one day, and then 2 days later they've got a full-blown infection. So that's got the Leerberg now and the antibiotics, and it's at 6 mils. So I'm going to put it up to, like I mentioned, 8 mils. And what I'm trying to do here is make sure that there's no air bubbles in this, because we don't want any air going into his tummy. So that's pretty great. I'm just attaching a F5 feeding tube, which is one of the smallest that I have here. It's very, very thin, but it's very, very long. All the feeding tubes are long. Oh, he's making some noise. So I'm going to get him out first. Now that we've got the milk in that, I'm going to put this, I'm going to run over to the kitchen, put this back in the milk warmer, because I'm going to feed Pierogi after this. All right, so now I'm going to get Puppy out, and I'm going to toilet him, although I only just toileted him a little while ago when he arrived into my care. But I'm going to toilet him again. Where are you, baby? All the way over there. So this is little pork crackles. And as you can see, he has what's called a bilateral cleft lip, which means 2 cleft lips on either side. And he is incredibly tiny for a almost 2-week-old English Staffy. Obviously he's a blue boy, and he, because of all the human food, milk replacer, his body is was very much rawer now, but you can see on camera, I don't want to gross anybody out, but it's all still so tender. That's because he's got an infection and he wasn't fed correctly, and that's really messed up with his gut and everything. Oh, there we go. All right, so I'm going to toilet him. I've got Paddy right here. He might jump up because Paddy is incredibly unwell, and yet, Paddy, you want this puppy? Can you see Paddy's nose? He loves a baby. He loves a baby. He's already toileted this puppy for me by licking and stimulating him, because Paddy thinks himself a mum. I don't know if you can see the change in colour. I'll bring it over to the camera, but the change in colour on the water wipe here. So that's wee. So he's doing some more wee-wees. And normally when you do this and you rub their little doodles, they normally stick their tongue out. I find boys particularly stick their tongues out, but he's really like hungry, so he's sort of just dabbing his little body. Probably has nothing there. All right. So normally when you get a puppy, I mean, I'll do it now, but I'm pretty sure I know how far to feed the tube in. But normally how you know how far this long tube goes in is you take the tip of the tube and you go to the back of where the ribs, you feel the back of the ribs, and then you extend it down and you go, all right, and you hold that. And this, put Puppy here for a second, this is the length of tube that's got to go into his mouth and down into his tummy. And luckily this tube in particular has markers, so that's sitting on 15 centimeters. I'm just going to put that back in the very sterilized hot water just to make sure it's sterilized. And what I do is why I got this lovely new face washer out of its packet. This was donated by one of our foster mums who fostered Sherlock and Watson. She made these. Her name's Margie. So Margie, if you're watching this, I'm still using your amazing little face washers that you provided me. I saved them a new one for each new neonate, and I wrap really tight, and a lot of people get really scared about wrapping them up and swaddling them super tight, but it's amazing that even the weakest puppies can be so strong, and they can get their hands out, their arms out of this little wrap, and they can pull the tube out, and that is not a good idea. So what I'm going to do now is I'm going to put this syringe in my mouth and hold it in my mouth so I can feed the tube down. So I won't be talking, but I'll be feeding the tube down the left-hand side of his throat, and I'll probably have a finger in his mouth very quickly while I'm tubing. I'll be holding him upright and I'll be getting him to suck on my finger, and that motion of sucking keeps the milk down in his tummy. He's hungry. I don't know if you can tell. Here we go. First time being tube fed. All right. Now I'm holding my finger in his mouth and I'm holding the swaddle really tight. What I'm going to do now is just like kind of clamp down on his ear or his toe, because I want him to make some noise. The reason why I want him to make some noise is I want to make sure that the tube hasn't gone down into his lungs. Now, if the tube's gone down to his lungs, when I pinch him, he won't make any noise. He'll be silent. He'll do like a silent scream, and then I'll have to pull it out because it will be down the wrong way. Now, as I'm talking and I'm letting him suck, the tube is slowly coming out, so I'm just going to feed it right back down to 15 again, and then I'm going to pinch him. There we go. Down the right way. All right, we're ready. Okay, so while he's sucking and I'm holding him tight, I'm going to slowly plunge this in. So this is the first bit of milk's going in right now. And you can actually see, you see his little paws escaped? So it doesn't matter how tight you do it, the little paw has escaped. And the tube has come out a little bit, so I'm going to keep feeding it back in. And I'm actually going to try and hold it on the side of his mouth there. It's a bit of a juggling act, but I'm sort of doing this a little bit slower for the camera. But I usually do this half asleep in the middle of the night with my eyes closed. I've just been doing this for so long that yeah, he's very content, and the milk is slowly going in, and that's his antibiotics. He's loving it. And then as the milk comes out, it's all in there. I pull this syringe and the tube up as vertical as possible just to let whatever can slide down into his tummy. And then you always pinch the tube because you don't want it to release any milk as you're bringing it up, because it can still make them aspirate. And now I let him relax a little bit with his little paws out of the swaddle, and just sucking on my finger, just staying upright as he realizes and he feels that his tummy is full. And just the sucking motion and staying upright afterwards really helps to keep the milk down. And while he's doing that, now that we don't need sterilized water for the tube, I always have very boiling hot water, and by the time we got through this, it's no longer boiling. But I've noticed that one of his eyes has started to open because he is reaching that 2-week mark. But this eye here is very crusty, so I'm just going to part it a little bit because I do think it was open. Oh yeah, it's very crusty. I don't know if that's showing up on camera, but it's very, very crusty, which means there was an infection there. And when they get to this age and their eyes are starting to open, it is okay if there's an infection in the eye to part the eyelids just a little bit and clean it down. The antibiotics he's on for his infection to do with the wrong food and potentially having aspirated, being fed with a bottle when he should have been tube fed by the breeder, that is. That antibiotics will help make sure he doesn't have aspiration pneumonia. It will help with his infection, and it will also help a little bit with this crusty eye stuff. The problem is when they have an infection this early on, it can make them blind by the time they open their eye. The good news is he's definitely got 2 eyeballs. I've had lots of puppies, well, not lots, but I've had puppies that I can tell that there's no eyeball in the eye socket, which means they'll be blind. And actually, probably about this time last year, we had a little puppy called Pot Noodles, who was a English Staffy. She was brindle, a female. She had a bilateral cleft lip. And did she have a bilateral? I think she did, yeah. And when she opened her eyes, she definitely didn't have a full eye in one socket, and then she was blind in the other eye. So she was born blind. But she had a lot of problems, a lot of midline defects, not just the cleft, not just the blindness. She had a screw tail, and she also had really big problems with her bladder and her bowels being connected to the right parts so that she could toilet properly. Sometimes she did toilet poo out of her vulva because her anus was very small because she had a screw tail. She was a really, unfortunately, medically not the best bred puppy. I believe the rest of her litter were totally fine, but she was just, poor Noodles, she just got all the problems. And sadly, she went into liver failure when she went on heat. We weren't able to dissect her prior to that, but her organs were all not functioning right. Anyway, so Puppy has pretty much come right out of his swaddle now, and he's doing what I call the nursing. So it's where they sort of want to lie flat and they start kneading. They knead like mummy's boobies so that milk comes out faster. So they push on it to make the milk flow go faster. And he's not regurgitating or anything, but he is blowing bubbles and saliva up on his nose, which is totally fine. He doesn't have a cleft palate, but he's a little bit, yeah. But he should feel pretty good. And I'm just going to yell at 2 of my older puppies outside, Punchy, Snickety, who are climbing on the outdoor furniture, waiting for their dinner. Impatiently, that is. So yeah, this is Little Pork Crackle. I don't have my nursery set up at the moment. When I do have my nursery and I have neonates back in the nursery, I'll do a full how-to tutorial on tube feeding, because there's a bit more of a process. Like normally I would weigh them before, weigh them after, take their temperature, but it was just really important for me to get the first feed into this little boy, and my nursery is filled with all kinds of donations and stuff, and it's just hard to get to where I need to for the scales and everything. If I can get it cleaned up in the next few days and move him in there, I will. He doesn't need to be in an incubator. He's going to be sleeping in my room in a little kind of cot thingy with some heat. And yeah, I'll just get up in the middle of the night. But he's pretty happy. Having the little tongue out, showing that he's relaxed. And he's very pink. And being very pink means he's got a lot of oxygen. He's very high, like he's just doing really well. So Stacey has done a fantastic job considering how unwell he was. It wasn't that the breeder was trying to make him unwell. It was just that she just didn't know how to care for a Klefty. They are really fragile at this age, and being fed the wrong way or the wrong food, the wrong amounts, not being warm enough, all kinds of things can actually kill them very quickly. So Stacey did a really good recovery rescue job with him, and yeah, I'm really grateful to Stacey, who looked after him, then transported him partially to Canberra, and then Erica, who is one of my all access Life of Pikers, she picked him up at Canberra and took him to Albury, and then Alison, who is a long time follower of Life of Pikelet, she has a like a caravan van sort of thing. She went and stayed overnight near the border, and was there this afternoon to do handover from Erica, and then she brought him straight to me. And that is someone at the front door, so I'm going to stop the video now. We'll do another one soon. Now, would you like some more milk? You still hungry? Are you still hungry, Bubby? No. Okay. You've got teethers coming through. I know, sweetheart. I know. Hang on, baby. Yeah. You latched? There we go. You better latch on. Just making a mess of it. There we go. What a mess. Good job. Good job, baby. it, baby. I think that's it. Okay, let me clean you down. Let me clean you down and then burp you. No, that's it. Come here. Come here. I know. Hey. I know. There we go. Now we're going to burp you. Need your nails cut, hey? Let me hold you here. Oh, good burping. Good burping. Well done. Now, are you ready for bed? Are you ready for bed for a while, hey? Still hungry? No. Have we got teefies? Let's have a look. Oh, we got teefies. I know. Okay. So that one and that one are very different. It's very hard to see, but you can definitely feel it. It's in the joint. This one feels very normal. And this one, oof, it's like, yeah. And we're going in to see specialist surgeon on Wednesday this week coming. Today is, what's today? Today's Saturday. So a couple more days. You get to see the surgeon. Okay, the vet staff have already met you over at Advanced Vet Care. They already think you're adorable. Adorable. We're gonna go back in. We're gonna go back in and have that little leg, hopefully, or that hip sorted out. Can I see teefies? Can I see teefies? Can mommy see teefies? Let's have a look. There they are. Oh, those big teefies. Yeah. Look at that big belly. Who says tube fed and syringe fed puppies are underweight and they don't grow as much? Who says this? Not me. Not me, says Pierogi. I know, baby. All right. Let's go. Put you back to bed. Good job. Pierogi's new name that's being thrown around in this house at the moment is Fat Tonio. Hang on. Sorry, guys. So yes, back to Fat Tonio here. As most of you know, I've had some outrageous nicknames over the years for my baby loves. There was Half Brain, Poo Pants, Poopy Chimp, Toilet Brush. Well, I'm going to pause this. Actually, I'm going to put this down. I'm sorry, it's going to go black while I do this. But yeah, over the years, if you can still hear me while I'm filming, I've had some outrageous names. And this little guy, it's not an outrageous name, but Pierogi's nickname in this house that's being thrown around all the time now is Fat Tonio. Because he thinks he is emaciated and wasting away, and he doesn't get enough milk. He gets basically 120 mils a feed, and he's almost, well, I think tomorrow he's a month old, which is kind of ridiculous considering he gets fed every 3 hours now. It's a lot of food. It's a lot of pooping he's doing. I'm going through so much goat's yogurt, goat's milk, eggs, and glucose. I'm literally having to make new formula every day, and it's basically 1 litre of formula every single day. Look at him. Fat Tonio. I can't even pick you up with one hand. Ooh, properly. Look at you, Fat Tonio. Look at you. Is that better light? Fat Tonio. Paddy won't have a bar of him at the moment now that he's unwell, but also Fat Tonio. Oh, there's a burp. There's a burp. Ridiculous. And I have a feeling that little pork crackle, when he comes in, is probably going to get named Mario next to Fat Tonio here. Oh dear. I don't know why I've gone for these like uber Italian names, but Fat Tonio is his name. Apologies to anyone that's got a name of Tony or Tonio. I'm not saying it means that you're overweight, but this guy is. This guy thinks he is tiny and he doesn't get fed enough. Hey? Another burp. Look at that. Every feed. Fat Tonio. Hey? Yeah. Yeah. Crazy. Crazy. All right. Now I'm gonna put you in your little home, your little hotel for now. I've got to buy you a bigger travel cot crib. Change your bedding in a minute. Yeah. You've got a penguin. You've got a hedgehog. Stop licking your lips. Like there's more. And you've got a puppuccino from Starbucks. You gotta be careful when little pork crackle comes in that you don't eat pork crackle for lunch. Hey? Antonio? He is very handsome. And he is very sweet. Just very demanding. And he's got teethers now. Can we show teethers? There they are. There they are. Ow! 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 Antonio, I love you so much, Antonio. Antonio. All right, I'm gonna zip this up. I'm gonna zip this up, Tonio. Move your feetsies in. That's it. So funny. He presses his face against the mesh. He does walk around on the floor a lot as well. He gets what we call walks. Tonio. Yeah, you. Yeah, you. I gotta clean up this now. Sterilize it all. Ready for the next feed. Antonio, I love you. Antonio. Antonio, I love you. Oh dear. Going, Antonio? Where are you going? It's past your bedtime. It's past your bedtime. Yeah. It's past your bedtime, Antonio. 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 Where are you going, Antonio? I love you. Good boy, Pierogi. Good boy, Pierogi. You just had a big dinner. You're going to have a shake soon. Tummy shuffle. Oh, don't you get sassy with me. I got a weird waddle because of your little hip. Your little hip. Where are you going? You're escaping. You're escaping. You got your first leaf. Is
that your first leaf? Don't escape. Don't escape. Ah, 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 ah. Ah, ah, ah. No escaping. No escaping the orphanage. No, no, no escaping. So cute. So handsome and cute. Oh, biting mama. Here comes Penny. I can hear her. She's coming out to see what the fuss is about. We are all set up in a new travel cot. Secondhand one that Kat went and grabbed for me off Marketplace last night. This big boy Pierogi is getting sick of being in a little carrier. Well, it's a soft crate, but even that's too small for him now. It's about half the size of this, so he's graduated. But also in here is a little snuggly baby. There's a hot water bottle there that he's on. I've just got to monitor that Pierogi doesn't eat him. So far, so good. Pierogi likes these baby toys that I have had for ages and thought about throwing out or donating. But thankfully, they've come in handy. Yeah. Not puppy toys, but they're human baby toys, so they'll be fine for a little while until they become a bit dangerous and he might ingest them like the hounds did when I hung them up for the baby hounds. Anyway, this is just in the living room where I can keep an eye on them. And my little feeding station is set up here because the nursery is so full with like donations and all kinds of things. Just chock-a-block. I need to get in there today amongst sorting out finances because finances are killing me as always, but slowly getting on top of them. Anyway, enough about that. How cute is this little guy? Big guy. Kat's on her way. She's just picked up some orders at the post office. I've just been ordering all the things that I need, like dish tablets and stuff, because we just run out of them so fast, and antibacterial wipes and all that malarkey. And so Kat's hopefully picking up, well, she's picked up some of those things, and I've asked her to get a human baby bottle, a big one, to feed this monster, just making sure he doesn't hurt the baby. Tonio! 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 Do you know your name, Tonio? Look at that little tail wag! Look at that little tail wag for Tonio! Tonio! You just ate. You don't need more. What is it, Fifi? Puppies, contain, just like you like. I had Pierogi in the kitchen with the two sleepy boys, but they were boring him because they're having their morning nap, their midday nap. And I'm still in my pajamas because I've been up all night, but the hounds are happy. I just gotta sort out my other kids and on to work, the finances and the fundraising. Paddy's doing even better today, although he's hot. I haven't got the aircon on yet, which I'll put on. Paddy, did you eat big dinner last night? Did you try and eat Blanche's dinner last night? You did, didn't you, Paddy? I know. I'll get the aircon on for you, baby. Alrighty. Off we go. Sort out some more things. Show everybody. Lots of wee-wees. Lots of wee-wees.
See, our little eyes are open. Much more open today. Good boy. Good boy. Rolling. Good boy, buddy. Alright, let's see if we can do a little burp. There's no burp, is there? He did a little blip. Nice and full. Is that a blip again? Is that a little blip? Let's see if we can get a blip close. Ah, there it is. There it is. Is this relaxing, is it? Is that relaxing, baby? Good boy. Good boy. Such a good boy. Oh, such a good boy. Ears aren't open yet, just your eyes, so you can't actually hear me, but we talk anyway, don't we? Yeah. Yeah. Alright, back to bed. I'm gonna go get your brother. This is the first time with feeding a bottle of little Pierogi, but before I do that, I've just gotta sterilize this. So this is the really hot water. I'm just putting it into the tube, running hot water through the syringe this way. I do it a couple of different ways because we do reuse these syringes, otherwise it's really wasteful. This is like boiling hot filtered water, so it's really sterile. Back through the tube. You can see the water is so clear, and that's because I cleaned up that. And then what we do is we use one of these hospital grade, you find these in hospitals, human hospitals. Hospital grade antibacterial wipes, so they're not like the ones you buy from the supermarket or anything. So I always just clean it down like this. I try and keep this work area really clean, and rubbish I remove every time after a feed, and I clean it down again. And of course, because my fingers are touching all these things, it also makes them very clean. I'll put that there and get ready for the next feed. It's a water wipe just to get the stuff off. And now we're going to try Big Boy with this. Okay, Big Boy. How are we go. This is the first time with this kind of bottle, so he's going to be a bit confused. That's it. It's okay. It's okay. What I'm going to do is hold your head up. That's it. That's it. There we go. I know, it's always confusing. You can't be feeding out of a syringe anymore because you need more. That's it. You can do it. You can do it. Your mouth is well big enough for it now. We're not going back to the syringe. So you're going to move on to solids for a few days. Baby anymore. You've got sharp teethies. You've got to have a clap. There we go. There we go. Sort of getting it. Just biting it. Didn't get any milk out of that one. I need to cut the teat for you. Alright, maybe I'll cut the teat. Hang on. You're in for a mess. We're in for a mess, I can tell. Yeah. Are you hungry or are you not hungry? I feel like you're always hungry. You can't go near the hot water, Bubby. That's my arm. Ow, those teethers. Yeah, yeah. There we go. You're getting it. There we go. I reckon by tomorrow you'll be a little pro. There we go. Good boy. Too much. We don't want to drown. Sounded very Aussie then. Drown. Don't want to drown. Enunciate a bit better rather than saying drown. I live out in the country, I've got a real Aussie accent, don't I? Lucy, what are you doing in the background? Are you rubbing your boobies on the couch? Lucy? Oh, this is a real live action. What else has been going on in the background? Lucy, what are you doing? You are so funny. Lucy's a cleft dog. She's coming up to 4 years old and she has not been desexed yet because she's got a couple of things that we're worried about with going through a surgery because she has the cleft and she has a lot of sensitivity to medications and all kinds of things. So she'll be having like a specialized spay or desexing surgery, which will be keyhole. But it just means that she's had a couple of heats, which I'm not a big fan of, and her nipples are huge. And you can see her in the background. I don't have any desexed or unneutered boys in the house, except for little puppies like this. But we do not allow breeding in this house because we are rescue. And everybody's got defects and problems wrong, and we're not about adding more needy dogs to the world. And look at that, somebody's first bottle. It's gone, baby. It's gone. You did so good. You did so good, Antonio. Oh, there we go. That's see if I can do a burp. The reason why I'm always cleaning their faces from milk, oh, there's the burp, is that normally mama would be cleaning them down, but also like if you don't clean this down, like it is a formula of yogurt and goat's milk and egg yolk and glucose, it can actually, you know, become, if it gets all crusty and that, it can become unhealthy. So that's why I'm always cleaning them down, keeping them clean, just so we don't get any infections. Oh, there's another burp. All right, I'm gonna just quickly go grab the littlest baby and show you the size difference. So here we've got Pork Crackle, who is our little English staffy. He was born on the 29th of December last year. And here is Pierogi. He is what's called a micro bully. They should be about the same size, fully grown, as far as breeds go. Micro bullies are always heavier. And this one here, Pierogi, ow, he was born on the 13th of December. So about 2 weeks apart. Similar breeds as far as size-wise as adults, but Clefties are always, always, always smaller. People think that they're the runt of the litter. It's not about being the runt. It's just that they have what's called a midline defect. And usually it's not just one defect. Sometimes it's more than one. But Pierogi here, who we call Fat Tonio, because he's a big chunky boy. He's like a big mafia boss. He doesn't have any congenital defects that we know of. It's just the hip problem. And so nicknames for Pierogi and Pork Crackle are probably going to be Fat Tonio and Little Mario. I don't know why, it's just what I'm going with. But that's the size difference with 2 weeks of age difference. Crazy, huh? All right, they're going back in. And then I'm off to clean everything up. I'm gonna go sterilize this in the kitchen. Everything is pretty much set up, ready to go for the next feed. And that's how I do it. Snickly doodly. You be careful. Snickers. Snickers. Just because he's roly-poly don't mean he's filled with stuffing. To attack you now. Coming to attack you now. Boy Punchy. Hey, hey. Gentle. Oh my goodness. Punchy, what are you doing? So ridiculous. Now's your opportunity. Snicks! Snicks! Hey! Hey! Hey, gentle. You watch how Punchy he is with your brother. That's how you gotta be. Gentle. Gentle. Good boy. Is it nap time for everybody?
Hi, honey. We're here for your appointment. Okay? We're here for your appointment now. You're a big boy. We're going to go see the specialist surgeon and see what he has to say about your little hip. Okay? No, you're not a baby today. Today you're a big boy. Let's go in. Let's go in. Good job. Let's go in. Okay? Good boy. Pierogi. Let's go. Okay. I'm gonna go up in the lift. Hey, honey, are you okay, baby? That's the lift.
Yeah. And what have you noticed with him? So I guess the question is why, you know.
So I'll tell you the story.
Yeah,
so
what's brought you here?
basically, his breeder, so he's a micro bully, or what they call a micro bully.
Yeah.
His breeder was in a generic Facebook group about like just women in Melbourne and stuff, and just was like, is anyone here a vet? I have a young puppy, and I just said, look, I'm not a vet, but I rescue special needs neonate puppies with birth defect, sickness, all that kind of stuff. And we got talking, and she said, I don't know what's happened, but all of a sudden he's inflamed on this leg.
Right. Yep.
And she sent me videos, and I can show you those.
Yep.
And she said, it's swollen, he's limping funny, he seems in pain. This is at 10 days old. So it's on the 23rd of December. And I said, yeah, that doesn't look good by the video. And I said, I suggest you see a surgical specialist. I said, I wouldn't bother going and seeing a general practice vet. I said, I would, and I actually have Dr. Arthur House is somebody that works with me quite a bit with like clefties and all kinds of things. So I sort of suggested him because he is usually my go-to.
Yeah,
and
I know Arthur.
Who doesn't?
We all know each other.
Yeah.
He's pretty small.
Yeah, Arthur's fantastic. He's just very far away from me. So anyway, she said, okay, well, look, I'm going to take him into a vet anyway, because she hadn't taken him into a vet at all. And I was like, yes, please do. Go to your GP vet. GP vet basically, and that was on Christmas Eve. Christmas Eve said, he needs an x-ray because something's going on there. And the breeder decided not to do an x-ray because of finances. Right. And then decided to surrender based on conversations we had. Now, he's been too young to put under sedation, at 11 days old. So I did take him down to one of our emergency vets, and basically they just were like, I don't think it's a broken leg, but there's something going on with the hip. A couple of days later, the breeder got back in touch with me and was like, hey, I've got to come clean, because I was thinking, why has this puppy got a problem with his hip all of a sudden, or whatever? Maybe he's got bone issues, growth issues, maybe it's congenital, And she said, it's not congenital. The mum was smaller, bred with a 50-kilo male. Right. Had a cesarean. And during wake up of anesthesia, puppies were put with her and the breeder disturbed the whelping box and the mum turned and attacked this one and another one, killing the other one, leaving this one with wounds everywhere. Let's just poo. Sorry. Leaving wounds on this one. The breeder chose not to do and seek any vet care or anything. She spoke to a vet nurse who said, oh, if you take him into a GP vet, they'll just tell you to euthanize him. This is her story. And then so I said, okay. And she sort of got a little bit angsty with me, this breeder, because I hadn't got him in earlier with a specialist. And I said, well, it is Christmas and New Year's, and a lot of specialists are on holidays, and you know, people are off work.
Not us.
Well, you know, like I just, you know, and like I know Arthur, for example, who I would have gone to normally, usually is half off in January. So anyway, she then decided she wanted him back because she thought from videos that he didn't look damaged. But I can still feel a difference in that hip, and my concern is not necessarily that he may need surgery, but if it is something that could eventually mean like he needs a hip replacement or he has severe arthritis, I need to know this for his long-term care, adoption, all that kind of stuff.
For sure.
So
we're here to sort of just investigate that, I guess.
So I'm keen for x-rays.
How's he been?
Great.
Has he been
super
active?
Healthy, active, He does splay out the leg quite a bit. He puts weight on it, like he's had no issues with putting weight on it, but it's always been splayed out. It's kind of hard to tell because, you know, they do breed these dogs for shortness, muscle, thick, wideness. Like it's almost, to me, they sort of breed them in a way that is, what do you call it? They breed them almost like for deformities. Like, do you know what I mean?
But that's, I mean, that's
I know.
There's a whole lot of other breeds that
I know, I agree. Hence why I get lots of French bulldogs that have got cleft palates and spine and bifida.
Hence why so many of people like Arthur and I are in a job.
Yes, correct. Yes.
Look, I mean, palpating it, there feels like there's a tiny little bit of thickening on the inside of the.
So I think I feel like it's healed and just healed.
That's right. The range of motion of his joints feels normal to me, and he's not acting like he's in discomfort when I do any of that, which is. Good radio. Well, not so much to get really good radiographs, but it's hard to interpret often radiographs in puppies, like most.
Because their joints are floating, everything's not floating, but
their fasces are still all open. And so it's.
Is that him? Or?
Maybe the light's not good.
I can see it.
Well, unfortunately, the light's not great in this room for looking at X-rays. But if you see, this is right side, this is his good side. So that's his tibia there, and then his fibula comes up beside it here, right? And the fibula's, I mean, it's an essential bone, but it's not like a load-bearing kind.
He's fighting.
It's not a load-bearing bone, but it's got a lot of ligamentous attachments and muscle attachments and things like that make it important. When we look at his left one, which is here, can you see it? And sorry, I'll get the contrast right. It's just a little bit displaced caudally, and a tiny bit shorter relative to where the top of his or where his growth plate is in his tibia there. So if I flick backwards and forwards between them, it may just be that it's the orientation, because for some of these views you only have to be a few degrees off and it can look quite different. So maybe it's just that, but that's the only thing that I can see that's kind of got me at all sort of like seeing any issues. Up around the hip joint, everything looks fine. We've got a whole lot more views and stuff, but everything else looks okay. The bone along the femur here just looks like maybe it's had a bit of trauma at some point, but I'm not worried about it. And everything's got its normal range of motion. And he's not painful on it.
It does feel different though. Do you notice
it does,
that?
and I think that's what it is. And maybe when he got bitten, either scar tissue affecting the growth, or possibly when the trauma occurred, it might be that it actually displaced the top of the fibula a little bit. Now, you know, that in and of itself is not likely to be a major problem.
Right.
And there are, I mean, there's surgeries that we don't do anymore that were done back in the 70s and 80s where they would move the fibula head, you know. So the fact that it's moved is not a big deal. My advice would be that
we monitor.
he's probably going to be totally fine. And in terms of your thoughts about, you know, finding a home for him and everything, it would come just with the very slight caveat that, you know, maybe it might lead to an issue, but I don't think so.
Great.
There's nothing like obvious.
Great.
So yeah, that'd be my thoughts.
Oh, that's so great.
And with regards to the monitoring, I think palpation for patients like these, you know, for someone like Arthur or myself, whoever you see, you know, I think palpation even at 6 months would be enough for us to be comfortable with it.
Okay.
But certainly, you know, come back if you're worried about how his legs are growing or anything, deviating or anything weird like that.
Well, my plan is not to keep him in rescue for as for super long. Like, I'm happy to get him.
Like, I don't think this is a biggie. You know what I mean? And even if maybe he had something occur with it, you know, the tibia is probably the most operated on bone. Yeah. You know, orthopedically at least. You know, because of the amount of you know, cruciate surgeries and things like that we do. So you know, we've got the capacity to fix things in the tibia and around the knee usually. If something did pop up.
And how did he go with anaesthesia?
He was fine. So we've got an anesthesiologist who I left all the decisions with him.
Great.
And he might be a little bit tired, but
he is a bit tired. I can see it in his eyes.
He just I just give him a little bit of food as soon as he can, and
we're going straight home. His meal's in the fridge, so we'll just warm it up.
Sleep it off.
Oh, I don't know how much sleeping off, but thank you so much.
Yeah, no worries. Our pleasure. And give me a yell if you've got any hassles down the track.
Yeah.
And his history's obviously always.
Just leaving the vets now. And baby is already falling asleep. We're waiting for the left. And it's good news. Not massive issues, thank goodness. We're just going to have whoever adopts him monitor him, get checked again at 6 months old. And but yeah, it's looking really positive. Down we go. Yeah, we're in the lift on the way home. On the way home, little baby. This guy never falls asleep in my arms anymore. Don't start crying. Don't start crying. We're gonna get in the car and go home. Have a big meal when we go home. I know, baby. I know, baby. Good boy. All right. Time to head home. I know. Just getting the car ready. Go back to sleep. Go back to sleep. Look at your pupils. You're still really high, baby. You're still really high on your medications. I know. I know. Snickily. Snickily. Henry. All right, come on. Punchy. Good boy. Good boy, baby. Good boy. Should we all go inside? Yeah? Fifana? It's cold out here. Hiker's chimes blowing in the wind. Come on, let's go inside. Okay. Hey, 1 week without our baby, hey? 1 week without Patty. Tell him, Blanche. Tell him. Trying to have a nice moment. Thinking about our big boy. Our big baby boy. Hey, Fifa? All right. Come on. Penny, I'm going to give you a lift. We're going to go inside. Gentle, Punchy. Gentle with those big glangly paws. Come on, Foof, let's go. Let's bring these kids and go. I know, Snickers.
So what I'm putting in this bowl is it's a balanced raw diet. It's the protein is chicken, and so it's a 90% muscle meat, 10% bone, 10% organ, and then there's a little bit of like herbs and vegetables sprinkled in there and blended. I don't know if you can see, there's like you can kind of see greenery in there if you really dig around. So this is for Pierogi, puppy Pierogi. So he gets this now. He's on this yummy, raw, balanced diet. And then, because he's still very much a baby, he's still getting formula mixed in with his, I don't really want to touch it with a glove. I'm just going to use this. Take the glove off. Normally I'm mixing the milk, but I think I'll just have to pour it on top today. But he's still getting a bit of the homemade Leerberg formula that I make. And this is basically a blended mixture of goat's milk, goat's yogurt, egg yolk, and glucose. And this is what all our neonates that come into Life of Pikelet get. It's freshly made. We freeze whatever I'm not using immediately, but it's just a really, it's very close to the I don't want to say it's very close to the formula that Mama's Milk produces, but it's just as good quality, if that makes sense. Like, it's better than having like the powdered formulas like Divetalact and Wombaroo. They're really good if that's all you've got access to and you don't have time to make your own formula. But as somebody that is constantly feeding neonatal puppies, I find this puts on the most calories. It keeps their tummy really settled, keeps them hydrated. It's just a really good formula. I have sort of made my own recipe over the last couple of years in that what I add, the quantities that I add. A lot of people don't use, like, they'll use goat's milk, but they won't use goat's yogurt. They'll use cow yogurt. I actually think goat's yogurt, if you can find it, it's quite hard to find sometimes, is better for them. It's just closer to what a puppy can digest as far as their tummy. Cow milk and cow yogurt isn't quite as close to puppy. Oh, just spilled that there. Anyway, so this is heated up for puppy Pierogi. I'm actually going to keep it in the bottle warmer, which is right behind the camera. And this is his food. So, sorry, the milk that I just put there is for puppy pork crackle. Now I'm going to just put some boiling hot water in here. Just boiled up some hot water and I put it in one of my little bowls, and that's for keeping everything sterilized. All right, now I'm going to film feeding puppy Pierogi eating his breakfast. And of course down here are these two hopeful boys. Two hopeful boys who have already, oh, I'm not even filming you, not even filming you. Is that better? There we go. There we go, two hopeful boys who are hoping to get some more food. They've had their morning treats and snacks. It's time for their nap. Oh, Punchy, yeah, you don't drink this. You don't drink this, baby. All right, so let's go feed puppy Pierogi now. All right, that's a bit better. I had the camera around a bit differently, but just left the kitchen, and of course I have to keep these guys baby gated behind while I'm feeding the little man, the little big man, who is ready for his food. And this is quite a lot of food for a puppy of his size and age, but he is a champion when it comes to eating and food. He always has been. He's a very healthy boy. I'll just move him around so he's, oh, there you go, baby. It doesn't get any better than this for starting a puppy out on a healthy diet. This is much better than kibble. This is much better than what a lot of breeders would call puppy mush. Puppy mush is essentially soaked kibble blended with maybe some processed puppy milk that you can buy from the store, or some Dibetalak or Wumbaroo. Some breeders that are really old school, which they shouldn't be doing anymore because it brings absolutely no nutrition, it's just filler. Back in the old days, they used to feed puppies Wheat Bix and mush that up. It's really unhealthy. Wheat Bix does nothing for a puppy or a dog when it comes to dietary nutrition. It's not great for growing bones. It literally is just filler. It's just something in their tummy. It's a very old school way, and people just didn't know better. It was just sort of the myth of what you should feed a young puppy. But if you really think about it, like, what are they getting from it? They're not getting anything. It's basically just filling their tummies. Whereas this is a balanced raw diet, and it's got everything in it, and then plus the Leerburg milk, which has just made this little pup so healthy, considering he hasn't nursed on his mum since he was 10 days old, and he is now 6 weeks old today. So I'm really proud of how healthy he is, and how it's grown so well. Yeah, there you go. Took him less than 2 minutes. Good boy, baby. Good boy. Are you wagging your tail? Are you wagging your tail? So now I usually let him free roam the living room a little bit, because I don't like him, if I can avoid it, pooping in this crate, because then he walks in it and makes a mess. I'd actually rather him poop on the floor where I can clean it up really quickly and sanitize the space. So I'm gonna let him out. Oh, come on, come on. And he'll probably terrorize the dogs that are out here in the living room. I'm gonna put this in the dishwasher. That's one thing that I guess people don't really think about when you're running a rescue and you've got lots of dogs in your care. I wash all the dog bowls after every feed, and so dishwashing tablets is always on our
wish list, and I think people think that's a bit weird, but I like have the dishwasher on almost 2 or 3 times a day, every day, because of the volume of dog balls and the volume of washing. I don't really cook for myself. I just have what the internet now calls girl dinner most of the time, which is just like bits and pieces, maybe a bit of cheese and crackers or a piece of toast and an egg every now and again, but I don't really have a lot of stuff to keep in the dishwasher for myself. It really is mostly dog stuff. Anyway, so now I'm going to start to film feeding baby pork crackle. Hey, what's handsome? Are you handsome? And I'm not sure if I've mentioned it in other videos yet, but even though his name is Pierogi, his nickname in this house is Fatonio! Fatonio! And he knows it, Fatonio! He's a little cutie! Yes, he is! He's very good at wagging his tail. Now that he's full, he's a little bit slower, isn't he, Foof? He's a little bit slower when he's full. He starts to get into a bit of a food coma. But he's a good boy. Punchy over there's a good boy. 2 good boys. So cute. So cute.
Okay, so it's time to feed little pork crackle here, who you can see since my last video is so much more animated. His eyes, he's moving a lot more. He will be 3 weeks on Sunday, and I'm just looking in his ears. I don't believe his ear holes have opened yet. Usually with neonatal puppies, they open their eyes around the 10-day to 2-week mark, sometimes a little bit longer. And their ears with all puppies usually open at around 3 weeks. So up until 3 weeks, they can't hear anything. Their little ear holes are sort of closed over. I've always talked to all my neonates, even if they're an hour old or 2 weeks old. I always talk to them. Even when I'm taking photos of them and I'm trying to get them to pose or look at the camera with their eyes closed, I'm still making noise. I don't know why I do it. But anyway, little pork crackle here, who has the nickname in this house as Mario, because there's Fatonio over there, as in Pierogi, and little baby Mario next to him is Tiny. I'm gonna get him fed. I've got to do a couple things first. First, I've got to toilet him. So with neonatal puppies, you always have to stimulate them until about the 3-week mark. They usually can poo and wee on their own. And little boy here, Pork Crackle, is already weeing and pooing on his own when he is in his little nest of a crate that I have for him. He was staying in the travel cot with Pierogi, but we just found that Pierogi was really a bit too rough with him, and so I moved little Pork Crackle here into a soft crate, much smaller. It's very padded, it's got hot water bottles in it, and it's in my bedroom so I can hear him overnight. Now, before I wrap him up and get him tube fed, I'm going to put him down and quickly get some milk into this syringe, and I've got to kind of juggle him not coming up close to this boiling water and also not falling off the table. So it's sort of a race. So you'll see I'm very used to juggling neonates and just because they go on the move. I don't mind him going over there, but we don't want him coming up. That's fine. You can disturb all of that. All right, so we successfully got the milk in the tube. The tube is in the boiling hot water to keep it sterilized. And now it's time to wrap this little boy up in what I call the straitjacket method, which I've shown before. And that is because it doesn't matter how little these puppies are and how newborn, they have a very innate ability and need to use their paws to knead the milk coming from the boob. And the same thing goes when they've got a tube in their mouth, and they usually can pull the tube out, and if they pull the tube out while I'm tubing milk, it can go into their lungs. So that's why he's in this straight jacket. Now I'm going to put my technique is in my mouth. I'm going to feed the tube in, and all the way down into the tummy. Now he's salivating quite a bit, so it's not regurgitation, but it is salivating. This is not a tube feeding tutorial. If it was, I'd be doing this a lot slower. I'd be explaining my technique. But because I'm so used to tubing puppies, I just do it really fast. And I know it's gone down the right way because I don't know how to explain it. But when you do this sometimes all day, every 2 hours, 24/7, for weeks and weeks and weeks with multiple puppies over multiple years, you really begin to just get a feel for it. It's like riding a bike or driving a car. Once you know, you know. I always pinch it before I pull it out so that nothing goes down the wrong way. So that was really fast. I wouldn't normally feed a puppy this fast if they were quite new, but he is almost 3 weeks old, even though he looks like a 1 week old puppy as far as size goes. Interestingly enough, cleft palate puppies, or puppies that are born with birth defects or midline defects like little pork crackle here, they always seem to be smaller. I know I've talked about this in other videos, but they're always a slower growth rate. They're always tinier. But one thing that does happen is they sometimes open their eyes or their ears or develop teeth a lot faster than what their own litter mates would. Not always, but sometimes it's remarkable. These guys are the ones, because they're being hand-reared, they can develop a lot faster. I'm just going to see if I can focus the camera. There we go. I don't know if it was focused before. So he's got a really fat belly right now. We're up to like 25 mils of milk a feed, which is huge for him. I do like to let him nurse on my finger because he doesn't ever really get to taste the milk yet. Eventually, when we get past this stage, he'll be eating out of a bowl, just like Pierogi, and he'll be able to taste his food. But right now, it's just the sucking that soothes him and feeling his belly fill up. And so he doesn't really know what he's missing. But what he enjoys, what's soothing for him, is sucking on my finger. It's really, Pierogi's down on the floor chewing my slippers. So another thing I'm going to do in this video, which might go awry, because I'm not really going to edit this, is I'm going to show you that this little dude's claws are so long and so sharp right now. Look at that. And if he were with mum, this would be tearing up her skin as he tries to breastfeed. What I tend to do with puppies is I just get like a human baby nail clipper. I actually have one floating around that is for babies specifically, but this is just gonna have to do because I can't find it at the moment. And this is just from Woolworths. It's just a generic kit. It doesn't have to be expensive or any fancy or anything. And so hopefully we can, with one hand, get the clippers out. Hang on, baby. I'm gonna put you down for a quick sec. We don't need those. We don't need those. We might keep the scissors on hand. And I use this rather than using these because these are too big and you can cut it way, way, way too short. Even now, because he's so wriggly, there may even be a little bit of blood. And anyone that's owned a dog, regardless of age, will know that if you cut too far, you get down to what's called the wick, and the wick is where it bleeds. It'll only, if it does get down to there, it'll hurt him for like a hot second, but they bleed. They bleed non-stop. It's a really high blood flow, just like with a dog's tail at the end of the tail, or their ears. If they ever nick the tip of their ears, anyone that's ever owned a dog that has had the tip of the ears, oh, I'm sorry, baby, I'm sorry. They will know that the ears, the tip of the tail, they just bleed and bleed and bleed and bleed, and it's really hard to get them to stop unless you have this magical powder here where you can dip whatever it is, and this will stop the blood flow. But I only use that for like really bad cases of happy tail, which is what it's called when a pup, hang on, did we do that one? I really need to get your dew claw on this side. Done. Now this one, and then the back legs. The back legs. I know, you're crying right now because I'm holding you still, not because I clipped you. I know. Meanest, I always say I'm the meanest mummy in the world doing this, aren't I? Oh, that was silly. That was not even, you did not feel that. You did not feel that. All right, let's do the back legs. Let's see if we can do them with you standing. Not near the hot water. Not near the hot water. Mummy doesn't want to, 1, burn you, 2, cut your nails too deep. I know. Hey, 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 hey. That's 1. I don't know if you can see the difference here already, but this is the one that I've just cut, and this is the one that needs to be cut. I can see the difference. They're so tiny and so like easy to cut compared to, don't you growl at mummy. Don't you growl at mummy. Oh, vicious. Vicious, stuffy. Oh, I'm sorry, baby. That might have been a bit too short. Last one, this last one. I can see that one of his nails has started bleeding because I've got some blood on my wrist here. All right, let's have a look. I reckon it might be one of your front ones. It is. It's just this one here. Just a little Toby in there. Some water. It's Pierogi growling. Well, this water that was boiling hot is now just lukewarm. So, and there we go. Nails clipped. And he will be a lot less active now that he's had some milk in him. But not less vocal. Not less vocal. It's hard to believe he's 3 weeks old, because when Pierogi was 3 weeks old, he was a lot more advanced. But then, as I said, he's a little clefty, a little pop crackle, and with a birth defect, unlike an injury that Pierogi has, they're just a little bit, they're always a bit smaller, and they just seem more like little babies for longer. But he'll be a big, strong boy one day. Aren't you, honey? Yeah? So handsome. So handsome. Alright, Mummy's gonna clean the tube now. So she's gonna try and do this with her mouth and the water, and managing you. So we just run this through a couple times, bring the tube out. You can't see, but I've got Pierogi lying across my slippers on the floor, chewing them, but sort of becoming sleepy. Oh, oh, oh. All right, so we've run the hot water, or the warm water now, but it is sterilized water, through the tube, and we do it through the syringe. And then what we do is I've got these hospital grade wipes that I think I've shown on camera before, and they are very good at sterilizing. So put that here where it's clean. Again. And I do change the tube and the syringe up every now and again, like as in I throw these away. I only use these maybe for like a week at a time of sterilizing and that, and then I throw it away and get a new one. So these are both fairly new. In fact, this is a new one from today. So little man is ready to go back to bed. I'm gonna give him a hot water bottle and he'll have a nice little nap now. Let's see if I can film him. Here he is. Maybe he can hear. I think your ears are opening. I think your ears are opening. Let's try again. Oh, I think your ears are open. Listen to that Staffy trill. Listen to it. Yeah, big boy. Big boy. You're gonna be a cutie. You're gonna be a cutie. You're gonna be a cutie. You're gonna be sassy. Yeah. Good boy. Good boy. All right, honey. All right. Gonna put you back to bed, clean up this mess, and then we'll start all over again in 3 hours, eh? Because we're down to 3-hour feeds, hourly feeds. And maybe in another 2 weeks, you'll be onto food like Fat Tony or your brother. Okay? Good boy. Good boy. Good boy. Yeah. Good boy. Itchy ears. I love giving them little ear scratches. They don't know how to scratch yet. Scratch around the collars, their scruffs, and their back. You do like a pacifier sometimes, but I don't think you're going to want to suck right now. You want to suck right now? No. You're full. Good boy. All right. Back to bed. To bed. Hi. Hi. Mario. Mario. The good boy. The good boy. You hungry? Are you 4 weeks old and still so tiny? Oh, don't growl at mommy. Don't growl at mommy. That's your milk. Let's get your milk into. Yeah. Yeah. It's a baby crackhead. Baby poop. Oh, 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 oh. Baby poop crackle. Baby crackhead. Oh, again. You're doing somersaults. You want to do another one? What's going on here? No, dummy, you can't come in, baby. Alright, you can see him. Tonio? You can have a sniff, but not a taste. Okay, that's it. Alright, let's weigh you. Let's weigh you. You're normally too wriggly this time. Too wriggly. That's great. Just over 400 grams. Yay! Yay! You should be much bigger at 4 weeks though, Bubba. Yeah. All right, come on. Let's get you fed. Let's get you fed.
Are you excited? Are you excited for a big, fat microchip needle? Oh. Now remember who hurt you, okay? It's not Mama, it's Kim. It's Dr. Kim. Dr. Kim, yeah, she's so mean. She's so mean. And that was the easy one, baby. Uh-oh. Uh-oh. I've told you all the horror stories, haven't I? I've had vets put in a microchip and it's come out the other side of the skin with white dogs. I had one young vet, he did it 3 times. Yeah, I said, do you want to take the puppy outside, like out in the back? Yeah. It's all right. It's a one-off. Gotcha. You're all mine. You're all mine for now. You belong to Life of Pikelet. 100% now. Good boy. All right. Testicles are coming in.
I was going to say, I just wanted to double check. I can feel
One.
one.
Yet. Still got time. Okay. All right. Well, that's it, isn't it? Oh, be gentle. He's going to be sore. Alrighty, well.
Okay, we're trying some hash brown. Since he decides he wants... No? I thought you wanted it. You like hash brown? To be fair, they're not that great, are they? Oh no, you like? You like now? He does not like hash browns. You've been crying for hash brown. Oh no, you like now? Not so much. That is the funniest. Yeah, you spilt my hot chocolate. Okay, I went out of the car to go to the bathroom. I come back, my hot chocolate's all spilt on this towel. And the boys in the back are just very sleepy because they've had anti-nausea tablets for travel sickness. Punchy has. Punchy, sit. Punchy, sit down, baby. Sit down. It's all right, honey. Sit down. I know, baby gets sick. Snicky's already asleep. I know, honey. You get car sickness, don't you? It's okay. We'll deal with it. Ridiculous. Now we're off to Barking Good to get some proper food for proper puppies. Yeah? Some good food. We'll ring up a big bill again. Yeah. What's going on here? Oh, are you swimming in your... Someone's gonna need a bath after this. Baby boy here's got a bone. It's keeping him busy and happy. And we're having the first chicken and
Lerberg. You can still eat it. That's it. I'm so glad I didn't do this in the incubator. Baby, this is so gross. I think you're enjoying it. Come on, come on. That's it. We eat until you're full. And then I'm going to give you a lukewarm bath. Make sure your airways are clear. Clean your incubator because you pooped in it. I know. So for anyone that hasn't seen the nursery before, I haven't really had it functional for quite some time. So it's still not 100% functional. It's just doing the job for these 2 pups that I have in care at the moment. But essentially this is where I always do tube feeding, weighing. There's the iPad where we put all the details in of neonates when they first arrive. Oh my goodness. This is a defunct incubator. It like the other one, they both are not really working super well. So we need replacements, which is something I've tried to fundraise for many years and just had other things that have taken up finances for the rescue. So we haven't actually been able to get the incubators that we want, which are from America, from Puppy Warmer. So yeah, it's a small nursery, but it's very close to the living room. And you come in here, and normally I have a bar fridge, mini bar fridge underneath here, which I keep all the formula and Lerberg and stuff, and I have a kettle set up, and I can boil water and stuff like that. So I basically can come in here at night time and do midnight feeds and stuff like that without having to go backwards and forwards to the kitchen. But at the moment it's just supplies, like that's all tubes in there for tube feeding, it's medications. This is Pikey, and in that big bag there, there's all kinds of Pikey and Patty clothes in there that I need to hang up and catalogue and put away. See, there's lots of ashes, cremations and remains up there, and there's some also here. In that cupboard that's behind the wardrobe, the hanger, the clothing hanger, is also supplies like syringes and tubes and all kinds of things. There's my little sitting chair where I sometimes, like, if I need to do nursing with the puppies, and I used to have a lamp there, I need to get another lamp. There's an oxygenator with the incubator set up, and then more supplies under there, and then back around to the door. And then these cupboards here are also filled with medications and supplies that I need. So yeah, it's the small nursery. We need new incubators, oxygenators, everything, but and that's one of the reasons why I'm not open to new intakes. I have slept in a few that I knew wouldn't need oxygen or like a really functional incubator. This just does the job for now. And if you see he's pooed there, I need to clean it thoroughly. And then yeah, we have the little cot in here. Normally have a rug down, but I've got to clean that. It's just sort of basic setup. All right, well, little guy's made a mess. He doesn't seem to want any more for now. Or maybe he does. I'm gonna go give him a bath before he gets cold. And 4 weeks old, almost 4.5 weeks actually. Yeah. Yeah, look at that full belly. Are you happy? Clean you down, warm you up, clean your incubator, get you back to bed for your next feed. All right, come on, baby. Come on. How you going with that bone, Tony? Good? Foof is staying guard. Oh. Come on, Foof. You gonna come with me to wash this boy? Let's go. Come on. Come on. Oh, hi, Penny. Hi, Penny. Hi. Good morning. Good morning. Hi. Hey. Oh, you're still covered in food. You're still covered in food. You're okay. Come on, I'll put you back in. Sorry to wake you up, baby. Sorry to wake you up. You good boy. You good boy. Big yawns. Big yawns. Don't growl at mama. Don't growl at mama. Go on then. You're okay. Sorry to wake you up, baby. What are you doing? What are you doing? Hey? What are you doing?